Hi, everyone. Welcome to the next part in our series on Healthy Heart, Healthy Brain by Doctors Bradley Bale and Amy Doneen. I'm really excited to get to talk with you again on the heart disease and stroke, the 6-step prevention plan. And we're going to focus today on the education piece. For those of you who don't know, my name is Linnea Baker. I'm a board certified family nurse practitioner, and I'm grateful for each of you for giving me some of your valuable time and showing up and joining me today. So last week we talked about the number one killer in the United States, which we know is heart disease or cardiovascular disease. And I shared with you guys that the majority of my background has been spent in cardiology and electrophysiology. So this topic is very near and dear to my heart, no pun intended, okay? And when we talked last week about heart disease, we said there's a 6-step prevention plan in this book, evidence-based and researched and presented by Doctors Bale and Dr. Doneen. And it's fantastic. That's why I'm doing this series off of this book, because if it gets me excited and lit up, you guys should be excited, because I've obviously been doing this a long time. I've been in healthcare over 25 years. And this information is very exciting, and it will empower you to be able to take advocate for yourself and have communication with your healthcare provider and really take charge of your overall health and wellness from an arterial health standpoint, which is so important. Okay. So today we're going to talk about education, and over the next several weeks, we'll cover the other topics in this acronym on the 6-step prevention plan. So first, we want to just acknowledge that knowledge is power. Know better, do better, right? And so I'm really passionate about that. And I really want to empower you guys to understand how this works and what's going on in your body. Because when you understand it, you're better able to communicate with your healthcare providers and be able to advocate for your own overall health and wellness from an arterial health standpoint. So there is a common misconception out there that heart attacks and strokes are a plumbing problem. And actually, in the book, Doctors Bale and Dr. Doneen bring this up and say that in the research, in the studies, it's actually that most of these events are caused by inflammation. And it's the inflammation of the plaque in the artery wall, and that plaque ruptures explosively. And they say, think of this like a volcano erupting. Okay. Now, anyone of you who've been following me for a while know that I talk about chronic inflammation, and it's the leading cause of chronic disease. It's the spark that triggers the chronic disease. And that chronic inflammation is the fire throughout your body. And we want to work on getting rid of that fire, getting that inflammation down. So that's a big part of what I do from a lifestyle approach side. Well, this is why it's so important, guys. They're saying in the studies that it's the inflammation of the plaque that's causing the explosive ruptures in the majority of cases for strokes and heart attacks. Okay. And when that plaque ruptures, that plaque breaks off and it blocks the blood flow to the heart or brain. And that means that any blood that has the oxygen in it going and hitting that blockage, that wall there, it won't go through it or around it. So anything on the other side of that blood vessel where that blockage is not getting oxygenated blood. And so that's where you have a stroke or heart attack. Okay. Now, on the other side of the fence, there's about 1/3 of cases that actually are caused from plaque erosion. Okay, so 2/3 are from that explosive plaque rupture due to the inflammation, and 1/3 due to plaque erosion. And plaque erosion is when you've got your artery, think of it like a tube, and the blood flows through the middle of the tube, and the inside of that tube, the artery lining, is actually eroding above the plaque. So you've got the plaque sitting along the lining of the artery, and above that plaque in the artery wall there, that lining is eroding. And they think of it in the book, they describe it as a sinkhole. And I thought that was a great way to visualize that. And when that sinkhole happens in that artery, just like it would in the ground, well, what happens is your body's triggered to form a clot to kind of close that gap or close that breach off, but there's still plaque there. So when that clot forms and the plaque is there, what's happening is you're getting a blockage in the blood flow, and that blood clot prevents, it's like an obstruction or a wall that prevents the oxygenated blood from getting to the other side of that. And that's when you can't get that oxygenated blood to the other side, that's when we have heart attacks or strokes, right? So there's a common misconception out there that there's nothing to worry about in your major arteries that are supplying the blood to the heart or brain unless they are at least 70% blocked. And this was something that was true when I was practicing in cardiology as well. This has been kind of the going rule of thumb. However, there was a major study 30 years ago, and it's an old study, right? But this is the information we know. 86% of heart attacks actually occur in patients whose coronary arteries, okay, coronary arteries are the blood vessels that bring oxygen to the heart, are less than 70% blocked. So 86% of heart attacks occur in people with less than a 70% blockage in their blood vessels in their heart, their coronary arteries. That's just mind-blowing, guys. And then actually 68% of heart attacks occur when major arteries supplying the heart, the coronary arteries, are less than 50% blocked. So not only are the majority less than 70% blocked, the majority are also less than 50% blocked. That's insane, guys. Okay. So this is different than anything that we were thinking or practicing, even when I was in this specialty. So again, many heart specialists, even the cardiologists, many of them still believe in the 70% rule, okay? And so what they do is they'll diagnose somebody with mild disease, mild heart disease, when the blockage is less than 50%. However, I love the way that they describe this because it's very eye-opening when I read this in the book. They say there's no such thing as mild heart disease. And that would be just like if someone said they're a little bit pregnant. You can't be a little bit pregnant. You're either pregnant or you're not. Well, same thing with heart disease. You either have it or you don't. There's no such thing as mild. So I thought that was pretty powerful. And I really want you guys to think about that and take that and process it, because it's important that you understand if you have problems with your arteries, you have arterial disease, peripheral artery disease, coronary artery disease, carotid artery disease, which is the disease in the arteries in your neck. Remember, we said all the blood vessels are made of the same type of material. So if you have disease in one of these arteries, it's possible to have this disease anywhere in your body. And there's no such thing as mild, because once you have arterial disease, it's just like saying you're pregnant or not pregnant. You either have it or you don't. There's no grade of mild to severe, because you can still have very serious disease, like we just said, and less than 50% blockages are causing the majority of heart attacks. So that's why it's important to know this. So 90% of strokes are called ischemic, and that just means they're caused by a blood clot. All right. And really, when we think of an ischemic stroke, they really happen essentially in the same way as what we described with a heart attack. You get inflammation that occurs around that fatty deposit in the artery that supplies the brain. And that leads to either plaque rupture or plaque erosion, and then a formation of a clot. And the clot blocks the blood flow. Okay. So, plaque ruptures when the inflammation's there and the plaque explodes like a volcano. The erosion piece is when the artery lining's eroding and you get a clot that blocks the blood flow. And it can either be a plaque obstruction or a blood clot obstruction. So in ischemic strokes, they can also occur when a clot forms elsewhere in the body and travels to the brain. So this is important. And a lot of times it's either the heart or the large blood vessels where the clot occurs. So atrial fibrillation is actually a field I worked in specifically when I worked in electrophysiology. And some of you, there's a lot of people that walk around with atrial fibrillation, and some of you may have heard of this. It's also called AFib for short. And all that means is it's an irregular heartbeat coming from the top part of your heart. So your heart, think of it as 4 chambers. You've got 2 smaller chambers up top and 2 bigger chambers down below. And the top chambers are called the atria. The bottom chambers are called the ventricles, okay? And the top chambers, when you have atrial fibrillation, that is when basically instead of going lub dub, where your heart beats sequentially from top to bottom, and it gives you lots of good output of blood flow, what happens is the top part of the heart's quivering. So when it's quivering, you're not getting that squeeze, that nice strong squeeze, top, bottom with the blood flow. It quivers and the bottom is still beating. So the top is quivering and the bottom still beating regularly. Well, what happens when the top quivers is the blood gets stagnant in there. It's not pumping the blood out efficiently down to the bottom of the heart. And so you can get what's called a thrombus, and it's a type of blood clot that sits in the top part of the heart. All right. And so that thrombus or clot can break off, and then that piece of that clot could travel out into the blood vessels towards the brain, and it could obstruct or block off part of the blood vessel, and that would be how people would have a stroke from a blood clot in the heart caused by that irregular rhythm atrial fib. Now, in atrial fibrillation, that's if it's untreated, right? So people who have atrial fibrillation typically are on, majority of the time, are on some type of blood thinner. They are on some kind of medication, maybe to slow the heart down. Sometimes it's a medication to get the rhythm to go to regular. Sometimes they have certain procedures to shock the heart back. It's called a cardioversion, to get it back into a regular rhythm. There's heart procedures to their heart ablations to get rid of the atrial fibrillation. So atrial fibrillation is a huge field. But just to know that it's pretty common, especially as we get older, and a lot of people have heard of it or walk around with it. And it's if it's not treated, when it's untreated, that's when we can get these clots and strokes. You're higher risk for that. The mainstay of treatment with atrial fibrillation, because we know it can cause a clot, is typically getting on some type of blood thinner that your doctor picks based on your medical history and your age and all other things that we take into account. Okay. So they will let you know what works best for you if you even have this. Okay. So then we have transient ischemic attacks, or TIAs, and TIAs are also known as mini strokes. They last a few minutes. However, a lot of people don't take these as seriously, and they should be taken seriously, because in the book, they cite that TIAs are basically warning strokes, and they require immediate medical attention. Even though they last a few minutes, any type of altered mental state or any type of stroke-like symptoms, immediate medical attention, 911, okay? And that's because these are warning strokes. And we don't know how long they're going to last when they first come on anyway, because we don't know if someone's having a full-blown stroke or a TIA, right? So you always err on the side of caution. You always call 911, because it's urgent to get someone into the hands of emergency medical staff so they can take care of the person, whether it's symptoms of a heart attack or stroke, because time is of the essence in these types of diseases. In order to intervene and help protect the patient's heart and to help decrease the effects of the stroke, they have got to get into medical care to get the interventions and treatments that can stop and slow down the process. Okay. So time is very important in these situations. So if someone's having a transient ischemic attack, that actually is considered a huge risk. It increases their risk greatly that they will have a subsequent full-blown stroke. Okay. And again, we don't know if they're going to have a TIA or a stroke when they start having stroke-like symptoms. So we never mess around. We just get them into the emergency room and call 911 so that the medical team can start taking care of them immediately. Okay. So we also have what's called silent heart attacks and strokes, and that's when the symptoms are very minimal or there's no symptoms at all. And actually, many heart attacks and strokes can be silent. However, even though they're silent, that they can still be just as damaging as if someone had a full-blown symptomatic heart attack, where they feel the elephant on the chest or the numbness to the jaw or down the arm, all the things, right? The chest pain, there still can be just as damaging if they're silent. So they also said that it triples the person's risk of dying from cardiovascular disease if they're having silent heart attacks. Okay. So 8 to 11 million Americans experience a silent stroke each year, and that's greater than 10 times the number that suffer from a symptomatic stroke annually, and that's nearly 800,000 people, okay? And they got this information in the book from the American Heart Association and the American Stroke Association. So how do you know if you're having a silent heart attack? Well, you can do a blood test called a high sensitivity troponin T, HSTNT, and that blood test will check for heart damage in patients who have arterial disease. And this lab is a biomarker test that measures the level of troponin. And troponin is a type of protein that we can find in our heart muscle. The thing is, the troponin levels will go up as the heart muscle cells are stressed or dying. And so that occurs if someone's suffering from a silent or symptomatic heart attack, those troponin levels will go up. So when we look at this lab test, studies have actually linked elevated blood levels of the troponin in the highly sensitive troponin test to future risk of heart attack, stroke, heart failure, pulmonary embolism, and death from cardiovascular disease. So because of this, there's several studies that are actually recommending that we use the troponin highly sensitive blood test as a screening tool so that we can identify high-risk patients and those with silent arterial disease. And that's because that would allow people to be treated prior to having a silent or symptomatic event. So what does the Bale-Donin method say and in their health and healthy heart, healthy brain book that we're getting this from? They're actually saying that based on this evidence, they actually recommend that because this test is widely available to all patients, they recommend that all patients with arterial disease, whether it's silent, a silent event, or they've had an event, that they go ahead and get this test so that it can evaluate their risk for having these or other cardiovascular events in the future. So whether they're having a silent event or they're just at risk for a future event, they say go ahead and get this lab test if you're somebody that has arterial disease, because they want to know what your levels are so they can get more information to help treat you. So this is one of their recommendations is for patients with arterial disease. Okay. So what's the takeaway? Definitely not to scare you. This is to educate you. And so the takeaway message really is that both silent and symptomatic cardiovascular events are preventable. And they're preventable when you use the optimal care advised with the AHA, which is the Arterial Health Assurance for Life plan. And that's the AHA for Life plan is the plan that doctors Bale and Donin talk about in this book, Healthy Heart, Healthy Brain. And really, we want to bring you education. That's their mission, to bring education to you on how the events occur, to empower you to make choices that will lead to arterial wellness, okay? Because again, we know that heart disease is the #1 killer in the United States. So let's do something about it. Let's empower you and give you tools to go have these discussions with your specialists, your healthcare providers. And this, like I said, is evidence-based. It's researched. It's out there in this book. The book I'm going to share with you in just a minute. But just remember, guys, I'm on a mission to positively impact your health and wellness through education and coaching to create generational health and a health span that equals your lifespan. I'm really passionate about that. And I'm so excited. I know this can sound very scary with the information I'm giving you, but this book is so empowering because when you understand what's out there and available to you to take control of your health and get in with your healthcare provider and have these discussions and figure out what you can do to be even healthier if you're a person who has arterial disease, and knowing what that is. Remember, we went through how to even assess your risk. We did that early on in this series. So knowing all the different things to assess your risk, because there's more things like your dental health we talked about. There's so many more things that put you at risk for heart disease that our older models and risk assessment tools that we use in healthcare, we're missing too many people. And so now we have a better way to catch more of the people that are at risk so we don't miss it in healthcare. And so I want you guys to realize what's out there so that you can do a good job taking care of yourselves and advocating for yourselves. That is part of my mission and really what I'm passionate about. So if you're frustrated, overwhelmed, you don't know where to start on a healthy lifestyle, guys, reach out to me for a free health consult by commenting below or private messaging me. And this is the book I'm getting this information from, Doctors Bale and Doctors Doneen, Healthy Heart, Healthy Brain. It's fantastic. I got my book on Amazon. I have nothing to do personally, like I didn't write the book. I don't get anything from this book. I just think it's a great resource and tool. It's written in layman's terms, so it's easy for someone who's non-medical to understand it. And this is like just a great resource for people to have. So if you are dealing with family genetics, you have arterial disease or some kind of heart disease, or if you had a stroke or anything, just really, guys, this book is going to give you so much information, and you can read it faster than what I'll be doing, covering just snippets of it in this series. So feel free to go get that book. Like I said, I got mine on Amazon and it was worth the investment. So that now I have a tool with me that I can reference. Okay. And it is something that you could even bring in and have a conversation with your provider or specialist and tell them, hey, what about this? I saw this in this book. Is this a blood test I can have? And just empower you to have those conversations, guys. All right. So thanks again so much for your time. I hope that this presentation gave you some value and tools that are empowering you and educating you. And I look forward to seeing you again in a week. We will be covering the next part of the EdFrog acronym. So we did education today. So D is for disease, and we'll be talking about that next week. Until then, please be safe. And again, I'm so grateful for each of you. Thanks again.